In the world of interventional cardiology, there's a tremendous interest in the patient protection from radiation and the dosage that they get. There's also a great interest in the operator and the doses that he or she gets. And that's one of the topics that we're talking about right now. I'm with Ariel Rogin, MD, PhD, the Director of Interventional Cardiology at Rambam Healthcare Campus. And the whole issue here is you've taken a look at brain malignancies. And I want to emphasize right off, we're not trying to make this into anything more than it is. It's a preliminary look at an interesting topic. Tell me about your study.
Yes. So we as interventional cardiologists, we work with lead aprons that protect our body and with thyroid aprons that will protect our thyroid, and with glasses against cataracts. However, our heads are completely exposed to radiation, especially the radiation coming from the left side where the radiation source is. Now, several years ago, one of our colleagues, an attending in our center, who worked for many years in interventional cardiology, got a glioblastoma multiforme, a malignant tumor, and died several months following that. So I started reading on this topic and contacted many people around the world, and we found that there was little known about this issue, with only several cases reported. So we collected the known data, and we published on 4 new cases, all of them with glioblastomas, and with what was known in the literature. Following this publication, I got massive amounts of emails from different people, whether wives of physicians working with radiation, colleagues, and sometimes physicians themselves, contact me and saying, look, I am working with radiation, I worked in the cath lab for 10, 15 years, and I have a brain tumor. So this raised this big issue of brain tumors among interventional cardiologists. What is very surprising is that when we know the side of the malignancy, and we don't know for all of them, but when we know, in 85% of the cases, the brain side that is involved is the left side. So in other words, when we work in the cath lab, the radiation is to our left. So there's this disproportionate ratio of left to right glioblastoma multiformes and other malignancies. Now, I don't know if this is something, but I'm sure that this is something that we should study, and there is a call from us to create a registry. In other words, to try and find if this is really something. In other words, the fact that we found several cases does not mean that our profession is in danger, but this is a sign that we should continue and study it.
And particularly the way you found the left side predominance of these lesions. The other issue that I wanted to ask about is Sky is one of the, I was at their meeting in Las Vegas before I came here to EuroPCR. They're one of the ones who were interested in this topic, correct?
Yes, of course. We are thinking in collaboration with the Sky and with other societies like the Heart Rhythm Society to try and create a registry that will be very simple. In other words, we would like to contact, or we are still thinking how to do it, but contact lab directors to report anonymously if anyone in their center had a malignancy, and what was it, for how long did they have a radiation exposure, and from what side was the malignancy. And this is really amazing, because from almost every several days I receive an email saying this patient who was a physician got a malignancy and died.
I mean, as I said at the beginning, we're really interested in protecting patients. We really should be interested, too, in protecting the operators. What can doctors do to protect themselves until we know any more?
Okay. An excellent question. One of the things, even if we don't find anything, is that we should increase the protection from radiation. In other words, there are certain measures of how we work in the cath lab. There are protection of lead aprons and lead curtains that we can use. There are different technical issues of how many frames and what is the height of the table and so on. And when we know that this might have some danger, then we will take more care of ourselves. Interestingly, from talking with the other co-authors, there is for sure in interventional cardiologists early signs in their chromosomes. that are not that do not appear in patients, in physicians doing, for example, echocardiography or rehabilitation. Oh, wow. But these are early signs that are found in people that smoke cigarettes and in people who are exposed to radiation. Another point is that when there is a sum or a registry of all the people who work in hospitals with radiation, the field in medicine that is most exposed to radiation are the interventional cardiologists, whether it's EP or interventional doing a stent implantation and so on, and much more than all others, including radiologists or other fields in medicine.
Again, we're not trying to scare anybody, but the whole concept is rather interesting. And if you would like to find more information out, go to CardioSource Interventional News. We'll also have references there for you. I'm Rick McGuire.